Life has this uncanny way of throwing us into situations we never saw coming. Those moments that can truly shake us to our core.
Mhm.
It's how we navigate those unexpected storms, those personal crises, that really defines our resilience.
Absolutely. And that's precisely what we're delving into today. We're taking a close look at how we understand and respond to some of life's most challenging experiences:
Yeah.
crisis, loss, grief, and even violence.
Okay.
Our guide for this exploration is the Saunders Comprehensive Review for the NCLEX-PN Examination. We're focusing on the section that provides essential insights into these critical areas.
Okay, so we're essentially getting a distilled understanding of how healthcare professionals approach these incredibly sensitive and high-stakes situations.
Right.
We're going to cover a lot of ground, from the very definition of a crisis and how it unfolds to the different ways we process grief and loss.
Mhm.
We'll also be looking at how to recognize the warning signs when someone is considering suicide and how to understand and intervene in various forms of abusive behavior.
Yeah, things like bullying, family violence.
Right through to child safety issues, elder abuse, and the trauma of sexual assault. It's a comprehensive overview aimed at giving us a solid foundation of knowledge in these vital areas.
Exactly. Think of this as a focused exploration, extracting the key concepts, the assessment approaches, and, the crucial steps that are taken when these difficult realities emerge.
Right.
It's about gaining a clearer picture of how these situations are understood and managed.
So let's jump right in with crisis theory and intervention. When someone says crisis, what exactly does that mean in this context, like officially?
Well, at its heart, a crisis is a temporary state of intense emotional upset. It happens when an event occurs that someone perceives as a really significant threat,
Okay.
and their usual ways of coping just aren't cutting it. That feeling of being overwhelmed and disorganized is key.
So it's temporary, though.
Exactly. What's important to remember is that a crisis is not a permanent condition.
Hmm.
How someone gets through it really depends on their ability to find new ways to cope and the support they receive.
Right.
The goal of any intervention is to help them regain their balance.
It's less about the event itself and more about how profoundly it affects someone. Now, we go through phases in a crisis, right? Can you walk us through how a crisis typically unfolds?
Yeah, there are generally 4 phases we observe. It starts with what we call the external precipitating event.
Okay.
This is the initial trigger. Something happens, like a job loss, a breakup, or even a major event affecting the community.
So the thing that starts the chain reaction.
Right, then comes phase 2, the perception of that threat. This is when anxiety levels begin to rise.
Hmm.
The person assesses the situation, and at this point, they might still feel they can handle it using their familiar coping strategies.
They recognize the problem and try to deal with it in their usual way.
Exactly. But if those usual methods don't work, we move to phase 3. This is where coping mechanisms fail, and we see increasing disorganization.
Okay.
This can show up as physical symptoms, maybe trouble sleeping or eating, or difficulties in their relationships as they struggle to manage the stress.
Things really start to fall apart in this stage.
They do.
Yeah.
And that leads us to phase 4, mobilization of resources. This is the turning point where the individual starts to draw on their inner strength and seeks out support from their network. The aim here is to help them get back to their level of functioning before the crisis. It's about regaining stability, not necessarily becoming a different person.
And there are different types of crises: maturational, situational, and adventitious. What's the difference between those?
Okay, so think of maturational crises as those linked to the natural stages of life. Getting married, having a baby, retirement. They're somewhat predictable transitions that can still be very stressful.
Right. Expected, but still tough.
Exactly. Situational crises are usually unexpected external events, like the sudden loss of a job, an unexpected illness, or the death of someone close.
Okay.
And finally, adventitious crises are those rare, unplanned events that are like way outside the realm of normal experience.
Like disasters.
Yeah, natural disasters or violent crimes, things like that.
So different kinds of triggers that all lead to that feeling of being severely emotionally off balance. Now, how does crisis intervention actually work? What's the main approach?
Well, crisis intervention is immediate, supportive, and very focused on the here and now.
Right now.
The main goals are to help the person express and understand their feelings about what's happening. It's really important to help them connect the dots between the event and their current distress.
Makes sense.
Intervention also involves exploring different ways they might cope, maybe options they haven't thought of, and encouraging them to try out new and healthy strategies to navigate the situation.
So it's about providing immediate support and helping them find their way back to solid ground. Okay, let's talk about grief. Loss is something we all face. How is grief defined in this context?
Grief is the natural emotional response we have to a loss. It's the internal process we go through as we come to terms with the fact that something or someone we valued is no longer there.
Mm.
It's a necessary part of accepting that loss.
And there are often talked about stages or tasks of grief. We hear about things like shock, pain, and acceptance. Is that how it works?
Well, the process often involves stages or tasks, yeah. Initially, there can be shock and disbelief, a feeling of numbness, difficulty processing what has happened.
Uh-huh.
Then comes experiencing the loss, which brings with it a whole range of intense emotions,
Mhm.
sadness, anger, guilt.
All the heavy stuff.
Exactly.
Yeah.
Over time, the task becomes one of reintegration, starting to rebuild life and find a new sense of normal without what was lost.
And the feelings that come with grief can be so different for everyone. Anger, loneliness, sadness, even a sense of peace eventually, maybe.
Absolutely. It's a very personal and complex emotional journey.
Right.
Healing isn't about forgetting, you know.
Right.
It's more about the sharp pain of loss, gradually becoming less intense as we adapt to a changed reality while still cherishing memories.
There are also different types of grief. Normal, anticipatory, disenfranchised, dysfunctional, and children's grief. Let's briefly touch on those.
Sure. Normal grief encompasses the wide array of emotional, physical, mental, and behavioral reactions we've discussed, and it can take a considerable amount of time to work through.
Okay.
Anticipatory grief is interesting because it happens before the actual loss.
Like when someone's ill for a long time.
Exactly. Often when someone is facing a terminal illness or a significant impending loss. Disenfranchised grief is a particularly difficult one. It's when you experience a loss that society doesn't necessarily recognize or validate, making it hard to grieve openly.
That sounds tough.
It really is. Dysfunctional grief is when the grieving process gets stuck, leading to prolonged emotional instability and an inability to move forward.
Right.
And finally, children's grief is unique because how a child understands and expresses grief depends heavily on their age and developmental stage.
That's a really important point. We need to understand that children grieve differently. Now, how is loss defined and how is it different from grief? Are they the same?
Not quite.
Hmm.
Loss is simply the absence of something we desired or were accustomed to having. It's the actual event of something being gone.
Okay.
Grief is our emotional response to that absence. So the loss is the objective fact, and grief is our subjective experience of it.
Got it. And we talk about actual, perceived, and anticipatory loss.
Yes. Actual loss is something tangible that others can recognize, like the death of a loved one or losing a physical object.
Right.
Perceived loss is felt by the individual but might not be obvious to others, like the loss of trust in a relationship, perhaps.
Okay.
And anticipatory loss, like anticipatory grief, is when we start to grieve before the loss even happens, knowing it's coming.
And then we have mourning and bereavement. How do those fit into the picture?
Okay, so mourning is how we outwardly express our grief. It's the social and cultural rituals we engage in to acknowledge a loss, like attending a funeral or wearing black, things like that.
The external stuff.
Right. Bereavement is the overall state of having experienced a loss. It includes both the internal feelings of grief and the external expressions of mourning.
Okay, so loss is the event, grief is the internal feeling, mourning is the outward expression, and bereavement is the entire experience of dealing with that loss. Makes sense. Now, what's the nurse's role when someone is experiencing grief and loss?
The nurse plays a vital role, primarily through communication, talking with the client, their family, and significant others. It's essential to be sensitive to their cultural and religious background, their family structure, their past experiences, their usual ways of coping, and the support systems they have in place. Providing empathetic listening, validating their feelings, and respecting their individual needs and preferences are all crucial aspects of the nurse's role.
So it's about providing support that's tailored to the individual and their circumstances. Let's move to a really critical area, suicidal behavior. What are some of the key things to understand here?
The important thing to remember is that when someone is feeling suicidal, they are often experiencing overwhelming feelings of worthlessness, guilt, and a profound sense of hopelessness. They may feel like they're a burden and that others would be better off without them. For nurses caring for individuals who are depressed, it's crucial to always be mindful of the potential for suicidal thoughts.
Always keep it in mind.
Yeah.
And who are some of the individuals who might be at a higher risk of suicidal behavior?
Well, those with a history of previous suicide attempts are definitely at higher risk. Also, a family history of suicide, adolescents, older clients, individuals with disabilities or chronic illnesses,
Right.
people with mental health conditions like depression or psychosis, those who misuse substances, and individuals who have experienced bullying or social rejection are also considered to be at increased risk.
That's a wide range of vulnerabilities, highlighting how many different factors can contribute.
Yeah.
What are some of the clues that might indicate someone is thinking about suicide? Things you might see.
Yeah, there can be several warning signs.
Hmm.
This could include giving away valued possessions, withdrawing from social activities or canceling plans, making changes to their will or insurance,
Oh, wow.
a sudden shift in their mood. Sometimes a surprising calmness after a period of depression, changes in appetite or sleep patterns, expressing feelings of hopelessness, difficulty concentrating, a loss of interest in things they used to enjoy,
Hmm.
directly stating that they wish they were dead or are considering suicide, and even seeking out or talking about lethal means.
These are critical things for anyone to be aware of in the people around them. And when a healthcare professional is assessing someone who might be suicidal, what kind of information is important to gather?
Well, it's important to assess if they have a specific plan. What is it? How lethal is it? And do they have access to the means to carry it out?
Okay, the specifics.
Exactly. It's also crucial to know about any previous suicide attempts. What happened? What method did they use? And what was the outcome?
Right.
And finally, understanding their current psychosocial situation is key. Are they feeling isolated? Are they experiencing intense negative emotions? Are they using substances? Have they had any recent significant losses? And have there been any major changes in their life circumstances?
So it's a really thorough look at their thoughts, their history, and what's happening in their life right now. And what are some of the key steps a healthcare professional will take when someone is suicidal? What are the interventions?
Safety is the absolute top priority, always.
Right.
This involves assessing the immediate risk of suicide and implementing safety measures, which might include removing any potentially harmful objects from their environment. They should never be left alone if the risk is high.
Never alone.
Maintaining a non-judgmental and caring approach is essential to build trust. Depending on the situation and protocols, a no-harm contract might be discussed. Encouraging them to talk about their feelings and helping them identify any positive aspects of their life can be helpful. Active involvement in their own care, engaging in achievable activities, and ensuring that visitors are not bringing in anything that could be used for self-harm are also important.
Mm-hmm.
Continuous monitoring of your mental state and safety is crucial. Just constant assessment.
Constant vigilance and a real focus on creating a safe environment. Let's move on to abusive behaviors. The chapter talks about anger, aggression, and violence. How are these different from each other?
Okay, so anger is an emotion, right? A feeling of displeasure or hostility. It can sometimes be a reaction to feeling powerless or anxious.
Just the feeling.
Yeah. Aggression is a behavior that is intended to cause harm or discomfort to another person.
Okay, the action.
Right. And violence is a more extreme form of aggression that involves the use of physical force to inflict injury or damage. So anger is an internal feeling, aggression is a behavior, and violence is a specific type of harmful behavior.
So it's a spectrum of harmful potential. What kind of information should a healthcare professional look for when dealing with someone who might be abusive or violent? What are the signs?
Well, it's important to look for any history of violent behavior or self-harm, first off. Also, indicators like poor impulse control, a low tolerance for frustration, being argumentative or defiant, raising their voice, making threats, pacing, agitation, muscle tension, a flushed face, and intense staring can all be warning signs of escalating aggression.
And what are some of the steps a healthcare professional should take in these situations, the interventions?
Well, ensuring safety for everyone is the primary goal, always. Approach the person calmly and speak in a clear, soft tone.
Calm approach.
Be assertive in setting limits, but avoid being aggressive or getting into power struggles. Maintain a safe physical distance and use non-threatening body language.
Right.
Listen actively to what they're saying and acknowledge their feelings of anger. Try to understand what they believe they need. Offer clear choices and explain the limits and consequences of their behavior. If the situation continues to escalate and there's a risk of harm, be prepared to discuss the possibility of using restraints or seclusion as a last resort to ensure safety.
Right. Only if necessary.
Exactly. And finally, help them explore problem-solving strategies once things have calmed down.
The chapter also goes into detail about restraints and seclusion. What are the important things to understand about these measures? Because they sound pretty serious.
They are. Restraints, which can be physical, chemical, or seclusion, are very serious interventions and should never be used for punishment or for the convenience of staff.
Yeah.
That's crucial.
Okay, absolutely not for convenience.
Never. They are only justified when a person's behavior poses an immediate and significant risk of physical harm to themselves or others, and only after less restrictive measures have been tried and haven't worked. Or if the individual specifically requests seclusion, which sometimes happens. It's crucial to document the specific behaviors that led to the decision to use restraints or seclusion.
Documentation is key.
Absolutely. In an emergency, a qualified nurse can initiate these measures, but a physician's order must be obtained as soon as possible, typically within 1 hour.
Wow, that fast.
Yes. A psychiatrist must conduct a face-to-face assessment within that hour to evaluate the need for these measures to continue, and ongoing reassessment is required.
Okay.
While someone is in restraints or seclusion, they need continuous monitoring, often one-to-one, to ensure their safety and well-being. Their basic needs, like food, fluids, and bathroom breaks, must be regularly assessed and addressed, typically every 15 to 30 minutes. Strict adherence to agency policies and considering any specific needs of vulnerable populations like older adults and children are essential.
So very strict guidelines are in place to ensure these measures are only used as a last resort and with careful oversight. Let's talk about bullying. It's something we hear a lot about, especially with young people.
Yeah, it's everywhere, unfortunately. Bullying is defined as the repeated and aggressive misuse of power by one or more individuals to harm or intimidate another. It can happen among children, in schools, in the workplace, and, of course, online now.
Cyberbullying.
Right. Bullies often seek to feel powerful by targeting those they perceive as weaker or different. Bullying can take many forms, including physical aggression, social exclusion, spreading rumors, verbal insults and threats, and cyberbullying through electronic communication. The effects on the person being bullied can be severe, leading to feelings of sadness, low self-esteem, isolation, and even, tragically, thoughts of suicide or violence.
Awful impacts.
Yeah. Healthcare professionals have a role in recognizing the signs of bullying and educating communities about how to prevent and address it.
So it's about recognizing the pattern of behavior and understanding its impact. Now let's discuss family violence, which is a really complex and often hidden issue. The chapter describes the cycle of violence. Can you explain how that typically unfolds?
Yeah, the cycle of violence often has distinct phases.
Good.
It often begins with the tension-building phase, where there might be increasing verbal abuse, minor incidents of physical aggression, and the victim often tries to appease the abuser to avoid escalation.
Walking on eggshells.
Exactly. This then escalates into the acute battering phase, which is characterized by more severe physical, emotional, or sexual abuse. The abuser loses control, and the victim's primary concern is often survival.
Terrifying.
After this acute phase, there's often a honeymoon phase or a period of calmness where the abuser may be apologetic, loving, and promise that the violence will never happen again.
But it usually does.
Exactly. Without intervention, this phase is usually temporary, and the tension will build again, restarting the cycle. It's also important to recognize the different types of violence that can occur within a family: physical, sexual, emotional abuse, as well as neglect and economic exploitation.
It's a really disturbing pattern of control and abuse. The chapter also talks about who might be more vulnerable and the characteristics of both those who abuse and those who are abused.
Right. Those most vulnerable to family violence are often children and older adults. But it's important to remember that anyone can be a victim, regardless of gender. Abusers often struggle with their own self-esteem, may have a history of being abused themselves, and often try to control their victims through intimidation and violence. Victims often feel trapped, dependent, helpless, powerless, and may blame themselves for the abuse.
It's a difficult picture of power imbalances and fear. What are some of the key interventions when dealing with family violence?
Well, ensuring the safety of the victim is paramount. That's number one.
Safety first.
This often involves reporting suspected child or elder abuse to the appropriate authorities, following legal and agency guidelines. Healthcare professionals will assess for injuries, provide a safe and private space for the victim to talk, offer reassurance, and a non-judgmental approach, and help the victim develop a safety plan, which might include identifying an escape route and resources for help. Assessing for any immediate danger, including suicidal or homicidal thoughts, is also crucial. Connecting the victim with support services, such as shelters and legal aid, and providing information about their options are vital steps.
Safety planning and connecting with external resources seem to be critical first steps. Let's move on to the frightening topic of child abduction.
Yeah, Child abduction is the act of taking a child without the legal right or consent of the parents or guardians. This can be done by strangers or, tragically, sometimes by a parent in violation of custody agreements.
Right.
As children become more independent, especially in the preschool years, teaching them about personal safety is crucial.
What are some of the things healthcare professionals can advise parents on to help prevent child abduction? What can parents teach their kids?
Good question. Parents should teach their children basic safety rules.
Yeah.
Never go anywhere with a stranger. Always tell a trusted adult where they're going, and when they expect to be back, teach them it's okay to say no to adults if they feel unsafe or uncomfortable.
Empowering them.
Exactly. Never get into a car with someone they don't know, and if they get lost in a public place, they should find someone who works there, like a clerk or guard, for help. Children should also know their full name, address, and their parents' names.
Basic info, yeah.
And it's also important to be aware of potential signs of trauma if a child has experienced an abduction attempt or, God forbid, an actual abduction.
Simple, but really vital safety messages. Now let's talk about child abuse, which is a deeply disturbing issue.
It really is. Child abuse involves any non-accidental harm or neglect of a child by a caregiver. This includes physical abuse, sexual abuse, emotional abuse, and neglect.
Neglect, too.
Yes, neglect, which is the failure to provide for a child's basic physical and emotional needs. Neglect can include not providing enough food, shelter, medical care, supervision, or affection.
Hmm.
Sexual abuse can take funny forms. Shaken baby syndrome is a severe form of physical abuse that can cause serious brain injury or death. There are specific physical and behavioral indicators that can suggest different forms of child abuse and neglect.
Recognizing those signs is so important. What are some of the key actions a healthcare professional should take if they suspect child abuse?
The immediate priority is the safety of the child, always. This involves carefully assessing the child for any injuries and providing necessary medical care.
Okay.
If shaken baby syndrome is suspected, close monitoring for signs of increased pressure in the brain is crucial. Healthcare professionals are legally mandated to report any suspected child abuse to the appropriate authorities.
Mandatory reporting.
Yes, it's a legal requirement. It's also important to create a safe and supportive environment for the child, document all observations objectively, and work with the parents to assess their strengths and needs, connecting them with resources and support services.
Mandatory reporting underscores the seriousness of this and the legal responsibility of healthcare professionals. Let's talk about latchkey children. What does that term mean exactly?
Latchkey children are those who are left unsupervised before or after school due to their parents' work schedules or other circumstances. While it's not necessarily abuse, it can create stress for the child and increase the risk of accidents, injuries, and involvement in risky behaviors.
So, potential risks involved. What kind of support can healthcare professionals offer in these situations?
Well, they can help identify families with latchkey children and encourage parents to teach their children essential self-care and safety skills. They can also assist parents in exploring alternative childcare arrangements or connecting them with community resources like after-school programs.
Finding those support networks can make a real difference for families. Now, let's address abuse of the older adult, another area that's often underreported.
Yes, definitely. Elder abuse involves any harm or neglect directed towards an older adult. This can include physical, emotional, sexual abuse, neglect, and financial exploitation.
Financial too, right?
Absolutely. Older adults who are dependent on others due to illness or frailty are at higher risk. Signs of elder abuse can include unexplained injuries, signs of neglect like poor hygiene or malnutrition, emotional withdrawal, and financial irregularities. It's crucial to be aware of these signs and to intervene to ensure the safety and well-being of older adults.
And reporting is mandatory here too, usually.
Yes,
Huh.
healthcare professionals have a legal obligation to report suspected elder abuse in many jurisdictions.
Recognizing those signs across physical, emotional, and financial domains is so important. Finally, let's discuss rape and sexual assault.
Okay. Rape and sexual assault are acts of sexual violence committed without the consent of the victim. It's important to remember always that the victim is never to blame. There are different forms of sexual assault, including acquaintance rape, statutory rape involving a minor, and marital rape. Victims can experience a wide range of emotional and physical trauma. Rape trauma syndrome is a term used to describe the constellation of symptoms that can follow a sexual assault.
What are the key steps in responding to a survivor of rape or sexual assault? What's the priority?
The first priority is to provide a safe and private environment and to assess the survivor's immediate needs and stress level. It's crucial to offer support, and a non-judgmental attitude.
Absolutely.
Medical care should be provided, and if the survivor chooses to report the assault, evidence needs to be carefully collected and preserved.
The forensic exam.
Right, which includes advising them not to shower, bathe, or change clothes before that forensic examination. Consent must be obtained for any examinations or tests.
Consent is key.
Always. Connecting the survivor with crisis intervention services and support groups is essential for their ongoing healing and recovery. Reinforcing that they are a survivor and that they did what they needed to do to survive is also incredibly important.
The focus on the survivor's safety, well-being, and access to support is paramount.
Yeah.
Wow. We've covered a vast amount of really critical information today.
Yes, we have. We've explored key nursing concepts related to crisis, loss, grief, suicidal behavior, and various forms of abuse and violence. Understanding these areas provides a vital framework for recognizing these difficult situations and responding in a way that prioritizes support and safety.
So as we conclude this deep dive, maybe something for you, the listener, to think about. How can we use this knowledge, even outside of a healthcare setting, to be more aware of and responsive to those around us who might be experiencing a crisis or facing difficult circumstances?
Yeah.
Being informed and compassionate can make a real difference.
It really can. And just to confirm, this has been a comprehensive deep dive into the chapter on crisis theory and intervention from the Saunders Comprehensive Review for the NCLEX-PN Examination, 7th edition. We've covered the essential nursing concepts, assessment guidelines, clinical procedures, safety protocols, priority actions, and relevant terminology discussed in that chapter.